Good morning. I am Dr. Jacob Thomas. I am an MD medicine and a DNB medicine, and I have trained in JJ Hospital where I did my MD, and MBBS I did from KEM Hospital or GS Medical College, Mumbai. Today in this session we are going to discuss about dengue fever. Dengue was not really rampantly or epidemically present in India as early as 20 years ago. In the last 15 to 20 years, the proportion or incidence of dengue has increased tremendously in our country. And now, come onset of monsoon and during the winter months where there is a lot of breeding of mosquitoes, the incidence of both dengue and malaria keeps on increasing, causing a lot of morbidity and mortality, loss of work, and lot of loss of income in our society. So let us discuss a few salient points about dengue. Dengue is caused by a virus, and this virus is of 4 types described as type 1, 2, 3 and 4. And there are many more subtypes of each of the types that we have described, that is 1, 2, 3 and 4. And at a time, one mosquito may inject one virus or sometimes even multiple viruses. And in dengue, what happens is sequential infection. That is, one mosquito might inject type 2 inside you. The second time, another mosquito might bite and inject type 1 or type 3 or type 4 inside you. And a sequential infection is what causes dengue. And the incubation period, that is the time from the bite to the onset of actual illness, is about 5 to 15 days. So, what causes this dengue is the dengue virus, which is present in Aedes mosquito. Aedes mosquito is also responsible for Plasmodium falciparum malaria and also for chikungunya. And it is a mosquito which bites 24 hours of the day, unlike the Anopheles mosquito which bites only during the night time. Aedes mosquito is present in shady areas, that is under the desk in schools, or in under your office table when you are working in as a desk job in your office, and it can bite you during the daytime itself. So in the life cycle of dengue virus, there are 2 hosts. One is the mosquito, the other is man. So when the mosquito, infected mosquito, bites a person, it injects saliva under the skin, and in that saliva the dengue virus enters the human body. As soon as it enters, it spreads throughout the body in the blood, enters the liver, the bone marrow, etc., and also remains in the bloodstream, and it multiplies rapidly. That rapid multiplication leads to the onset of clinical symptoms, and that is resulting in dengue. And when the mosquito, uninfected mosquito bites again, the virus enters inside the mosquito system. Inside the mosquito, the virus again multiplies in the body of the mosquito, and it goes and lodges itself in the salivary gland, so that next time when this mosquito bites another person, the dengue virus is injected into the new host, and in this way the cycle keeps continuing. And therefore, in the life cycle, these 2 hosts, that is the mosquito and man, is of primary importance in its life cycle. So once the virus enters the body, what happens is there are clinical symptoms, or there are different forms of dengue. But interestingly, in dengue, what happens is that what we call as sequential infection. So suppose a person has been infected with a type 2 dengue virus some time ago, the person may or may not develop a mild fever or clinical illness. But suppose this person, after a week or 2 or 3 weeks, gets bitten by another mosquito, then another dengue virus enters the body, and the previous virus, the immune reaction is enhanced. Because of the previous virus, the immune reaction, instead of getting suppressed, is enhanced. So what happens in dengue fever is that there is what is called an immune enhancement, and that enhancement of immunity is what results in a very severe clinical features when the second virus enters the human body through the mosquito bite. and therefore if there is different combination of viruses entering at different times, you get a clinical picture of dengue. And the spectrum of dengue is as such that one that can be a subclinical infection, that is the virus has entered the body but the person has no symptom at all, and later on when you do an antibody test, that is IgG antibody, it may just come positive, but the patient will tell us that he's never had fever at all. So that is the subclinical dengue. Then there is clinical dengue, where the person will develop fever, body aches, headaches, dehydration, maybe vomiting, weakness and backache. And the backache used to be a very typical feature, severe low backache when the fever was present in African continent. Therefore, in Africa it is also called break bone fever, that is the bone pains and the backache used to be a very severe feature. However, in our clinical setting, although we do get backache, it may not be a very prominent feature of the infection, and therefore that results in clinical dengue. Then there is dengue hemorrhagic fever, that is the dengue infection is so severe that apart from the other clinical features, the person can get bleeding also because of low platelet count. So the bleeding can be under the skin, that is patches, red patches or blackish patch. It can also be in the form of nasal bleeding called epistaxis or hemoptysis, bleeding in the cuff, or bleeding in vomiting, that is hematemesis, or bleeding in the urine or stools. So because of the low platelets, the person can get bleeding, and that results in dengue hemorrhagic fever. And the last spectrum, which is the most dreaded, is what is called DSS or dengue shock syndrome, wherein apart from the other features, the person gets severely dehydrated, the blood pressure drops, and because of the blood pressure drop, bleeding tendency, there is renal shutdown can take place, resulting in acute renal failure, and this can result in lot of morbidity and sometimes mortality also. So dengue fever by this mechanism can lead to death of the patient also, and that's why it is very important to understand and detect and treat it as early as possible. So what are the lab tests that we do? Immediately as you get a fever, within the first 3 days, one test called dengue NS1 becomes positive, that is the antigen test. Apart from this dengue NS1, we also get a complete blood count which tells us the WBC count and the platelet count. And the hemoglobin is not affected in dengue, and therefore a difference between malarial fever and dengue fever is that in malaria the hemoglobin goes down, whereas in dengue it remains the same or maybe even higher. Because of dehydration, the hemoglobin concentration increases, RBC concentration, and you might get a higher hemoglobin and a high packed cell volume, a PCV. The WBC count can become normal or low in dengue, and the platelet count will become low in dengue, and as the fever progresses, the platelet count keeps going down and it may reach as low as 3,000, 5,000 or 10,000, during which time the risk of spontaneous bleeding become very high, and the therapy involves transfusion of platelet concentrate. And in routine other tests that is done in a dengue fever is routine tests, electrolytes, the renal profile, liver profile which is deranged because of infection. However, encephalitis or brain involvement is very rare. So how do we treat dengue? Dengue is treated mainly by supportive treatment because there is no antiviral drug available for dengue. And the supportive treatment involves adequate bed rest, soft diet, lot of oral liquids to prevent dehydration, and that hemo concentration. To counter it, you need lot of fluids. Sometimes you have to admit the patient, especially if the fever is very high and persistent, the platelet count is dropping or the BP has started dropping, or if there is bleeding. These are some of the indications where we admit a dengue patient and we give IV fluids to the patient. We also, if the platelet count is very low and especially if there is bleeding, we give platelet transfusion. We have to do a close monitoring and daily a blood count to check the platelet count, and also closely monitoring the urine output and the intake status and the hydration status of the patient. Also, finally, the dengue prevention is similar to malarial prevention, that is prevention of mosquitoes breeding, and therefore locally, individually, what you can do is use mosquito repellent creams, especially even during daytimes, because it can bite at your feet when you are sitting in your office desk or in the school. And it can also in the house, you have to see that the AC vents, there is no water accumulation, there is no water accumulated below your refrigerators, and in the society, surroundings should be kept clean. There should be no stagnant water, all the ditches should be filled, the gutters should be sprayed with anti-malarial agents, and in general, clean surroundings and adequate and prompt treatment is what is required for dengue. Thank you very much.